Glaucoma is a serious disorder that is relatively common in our population. It's estimated that 5 to 10% of people need to worry about this problem. One of the biggest problems about glaucoma is that it is painless, and patients who have the disorder often are not aware they have the problem. Glaucoma is typified by a problem with the pressure regulation in the patient's eye. Sometimes the pressure may go up as high as 30 to 40 millimeters of mercury, where the normal pressure range should be 10 to 20 millimeters of mercury. You probably wonder, what do I mean about pressure in the eye? What is a pressure problem in the eye? And how does the eye have a pressure mechanism in the first place? Well, the eye is simply an inflated globe. And if the eye is injured, then the eye will sometimes collapse and be like a ball that has lost the air pressure in it. So our eyes have to have proper and normal pressure in order to work properly. If that pressure goes too high, there can be damage to internal structures within the eye. Most severely damaged is the optic nerve, because the optic nerve at the back of the eye is the very important connection from our eye to the back part of the brain where our vision is evaluated. So if that optic nerve is damaged inside the back part of the eye, then our vision is affected by that. And interestingly, how people lose vision with glaucoma is not their central vision that is lost, but it's like a gradual decrease in their peripheral vision. So they end up looking like through a tube if they've lost a lot of vision from their glaucoma. And so it's important to have the pressure in your eye be within that 10 to 20 millimeter range. Interestingly, some people, even with lower pressures, can have glaucoma. So just measuring the pressure by itself is not enough. You also need to have your pressure, besides having your pressure measured, you need to have the optic nerve in the back of your eye looked at on a regular basis with a dilated examination. And then we do some special tests if you have a tendency towards having glaucoma that look at the nerve fiber layer thickness in the back of the eye and also your ability to see peripherally. These tests are very important to be monitored regularly, especially if you have glaucoma. Glaucoma is usually treated with drops to lower the pressure, and can be, if drops aren't adequately lowering the pressure, treated with laser treatment or even surgery to create a new drainage system in the eye.